biggest anxiety right now is how to get to hospital. We have children who come 3 times a week for dialysis, and these are children with chronic kidney disease. And the challenges that this lockdown has posed for these families are a lot of helplessness because they don't have the finances, they don't have transport. Children for whom curative treatment is no longer possible. Some of them are in hospital, some of them are at home. With these children really struggling because ordinarily the kind of end-of-life services that they would receive are currently limited because family members aren't able to come and visit them. A lot of these wish fulfillments and things that we would ordinarily do for them, that's become harder now with the lockdown. For a lot of these families, what we're looking at is a lot of being there for them, managing their anxieties, their sadness. For the ones in hospital, we set aside time for play, for study, for activities that take their minds off their worries and the illness. We've had children who've actually resumed studies in an ICU setup. A lot of children for whom play has brought a lot of comfort. I think that this has been a big barrier for us, for me especially as a counsellor. Recently had a child who was pronounced dead at the casualty before the mother could get the OPD papers. Although there was this lockdown, although there were social distancing norms, we found that it was incredibly hard for us to maintain distance from that mother, and that she just needed to hold us and to cry, to sob. What's motivating for me is really some of the patients we work with, and there's a 13-year-old girl we've been working with who's a tetraplegic after having a fall from a swing, and so she's not able to walk and use her hands effectively, and she's been dependent on a ventilator. And this little girl who is so spirited that she wakes up and continues her exercises, and she is trying every day to get off that ventilator, and she has a zest for living which is very infectious. We sort of realize how much trust they place in the doctors and in the hospital, and this leaves us with the feeling that we have to do whatever best we can to support them and to make their lives in whatever way possible slightly more manageable and slightly easier in this current context, which is affecting all of us more so than